This is a summary of Dr. Nolan Williams, Psychedelics and Neurostimulation for Brain Rewiring, where we break down the key insights, ideas, and takeaways from this content, giving you the gist so you can decide if you want the rest. In this episode of the Hubermanlab podcast, Dr. Andrew Huberman interviews Dr. Nolan Williams, a psychiatrist and professor at Stanford University School of Medicine. Dr. Williams specializes in treating depression and mood disorders using transcranial magnetic stimulation, TMS, psychedelics, and neurostimulation therapies. His laboratory is pioneering new approaches that combine brain stimulation with psychedelic drugs to create lasting changes in brain circuits. The discussion dives into the latest science on how depression manifests in the brain, how psychedelics like psilocybin, MDMA, ketamine, and ibogaine are being tested for clinical use, and how brain stimulation techniques like TMS can rewire circuits linked to mood and cognition. This episode offers a cutting-edge look at the future of psychiatric treatments, blending neurotechnology with pharmacology to tackle intractable depression, PTSD, and other mental health disorders. The discussion explores the role of brain circuits in depression, why some parts of the brain become overactive while others become underactive, how TMS, transcranial magnetic stimulation, can rewire the brain, using electromagnetic pulses to restore healthy brain function, the growing use of psychedelics in psychiatry, including psilocybin, MDMA, ketamine, ibogaine, and 5-MeO-DMT, how ketamine treats depression, and why its antidepressant effects may be linked to opioid receptor activation. The controversial question of whether psychedelics work because of the hallucinations or because of biological changes in the brain. The link between depression and heart rate, how stimulating specific brain regions can slow heart rate and reduce depressive symptoms. Why depression and PTSD may be more like network disorders rather than chemical imbalances. The promising but risky effects of ibogaine, a psychedelic that may help veterans and trauma survivors recover from PTSD. The surprising antidepressant effects of sleep deprivation, and how light therapy can be combined with sleep shifts to reset mood. Depression as a brain circuit disorder. Dr. Williams challenges the traditional serotonin hypothesis of depression, explaining that depression is not simply caused by low serotonin levels. It is more likely a disorder of brain circuits, where some areas become hyperactive while others become underactive. The prefrontal cortex loses its ability to regulate emotional brain regions like the amygdala and anterior cingulate cortex. Key brain regions involved in depression. Dorsolateral prefrontal cortex, DLC, normally regulates mood and cognition, but becomes underactive in depression. Subgenual anterior cingulate cortex, SG, becomes hyperactive in depression, leading to negative emotional rumination. Default mode network, overactive in depression, causing excessive self-focus and negative thinking. Key takeaway: depression may be best understood as a failure of brain circuits to regulate emotions rather than a simple chemical imbalance. Transcranial magnetic stimulation, TMS, as a brain rewiring tool. TMS is a non-invasive treatment that uses magnetic fields to stimulate specific brain regions. How TMS works: a magnetic coil is placed over the scalp, targeting the prefrontal cortex. It sends electromagnetic pulses into the brain, activating or inhibiting circuits linked to mood. Repeated stimulation can restore normal activity to underactive brain regions, lifting depression. Stanford Accelerated Neuromodulation Therapy. Dr. Williams and his team developed an accelerated version of TMS, known as Stanford Neuromodulation Therapy. Instead of 6 weeks of daily TMS sessions, SNT delivers the treatment in just 5 days. Patients receive 50 TMS sessions over 5 days with breaks in between to enhance neuroplasticity. Up to 80% of patients experience full remission from depression after 5 days. Key takeaway: TMS can rapidly rewire the brain in treatment-resistant depression, providing a non-drug alternative to SSRIs. How psychedelics are changing psychiatry. Dr. Williams explores how psychedelics like psilocybin, MDMA, ketamine, and ibogaine are being tested as new treatments for depression, PTSD, and addiction. 1. Ketamine, a fast-acting antidepressant. Unlike traditional antidepressants, ketamine works within hours instead of weeks. It blocks NMDA receptors, increasing brain plasticity and rapidly relieving depression. New research suggests ketamine's antidepressant effects may depend on opioid receptor activation, raising ethical concerns. Psilocybin, magic mushrooms for depression. Psilocybin activates serotonin 5-HT2A receptors, leading to increased brain plasticity, greater connectivity between brain regions, dissolution of rigid thought patterns. 1 or 2 psilocybin sessions can produce long-lasting relief in some patients. 3. MDMA for PT. MDMA increases serotonin, dopamine, and oxytocin, enhancing emotional processing. Clinical trials show that MDMA-assisted therapy can reduce PTSD symptoms in 2/3 of patients. 4. Ibogaine. A controversial but powerful psychedelic used in West African rituals, ibogaine produces intense, long-lasting psychedelic experiences. May help veterans and trauma survivors by reprocessing painful memories. Has risks, can cause dangerous heart effects requiring careful screening. 5. 5-MeO-DMT, the toad psychedelic. A potent psychedelic found in Sonoran desert toads. Causes ego dissolution and a sense of unity. Veterans report major improvements in PTSD after using 5-MeO-DMT. Key takeaway: psychedelics are showing promise for mental health, but require careful medical supervision to ensure safety. The surprising antidepressant effects of sleep deprivation. 1 night of total sleep deprivation can rapidly reduce depression symptoms. However, as soon as the person sleeps again, the depression often returns. Triple therapy combines 1. 1 night of sleep deprivation, 2. Exposure to bright light in the morning, 3. Gradual shifting of sleep-wake times. This resets the circadian rhythm and provides long-lasting mood improvements. Key takeaway: sleep deprivation can temporarily relieve depression, but combining it with light therapy may create longer-lasting effects. Final takeaways: the future of brain rewiring for mental health. Depression is a disorder of brain circuits, not just a chemical imbalance. TMS and neurostimulation can rapidly relieve depression by restoring normal brain activity. Psychedelics like psilocybin, MDMA, and ibogaine offer new hope for PTSD and mood disorders. Ketamine's antidepressant effects may depend on opioid receptors, raising safety concerns. Light therapy and sleep manipulation can help reset mood and circadian rhythms. Dr. Williams concludes that the future of psychiatry lies in combining neurostimulation, psychedelics, and behavioral therapies to create lasting brain rewiring. That's a wrap on Dr. Nolan Williams, Psychedelics and Neurostimulation for Brain Rewiring. If you found this summary valuable, make sure to follow, subscribe, and come back for more in-depth breakdowns of content.